Food and nutrition are inextricably linked as the foundational principles for society, health, and longevity. But have you ever thought, how did it get here? What is its role in culture, history, and health? And what does it mean for health outcomes, the economy, and long-term functioning of society? Where do farmers, agriculture, a range of new technologies, including vertical farming and precision fermentation, the food industry, and eating fit into nutrition and health for people all over the world? Well, my name is Dr. Anneline Padayachee, and this is pretty much what I do day in, day out, looking at how food is produced and what happens after we have consumed it, it's worked its way through digestion, and its impact on human health.
Middle East is where dairy products were first from, fermented yogurts, those sort of things. These guys in the Middle East, they moved up into the Balkans, into Europe, and that's when we started getting a bit of a problem because the people up there couldn't really consume dairy. Babies could because they've got lactase, but adults couldn't. And so what was interesting is this particular fragment up there is a piece of pottery that's about 4,000 years old, found in Poland by an archaeologist in the 1960s. And he couldn't work out why does it have all these holes in it. So he sent it off for assessment, and what they found is on one side was dairy fat molecules. And they worked out that this was one of the first cheese-making implements in the world. So these guys up in Poland who could not consume dairy, suddenly have got some cows coming up there, and they've worked out, you know what, this is actually a good energy product, but we can't eat it. So we've got to modify it so we can eat it, so we stop dying, because it's good energy. And that's what they did. And so dairy ended up becoming a staple. So everyone's got a cow in their backyard, everyone's milking it, it's become a staple product. Fast forward to the start of the Industrial Revolution, we're in England. Plenty of dairy out there, everyone's milking. The only problem is the cows have got mastitis, there's pus, there's blood, there's gunk in that milk, and newborn infants who are drinking it are dying. Hello, pasteurization. We create something to deal with the problem that we're facing in society.
With over 20 years of experience covering the food industry, research in academia, even regulations, I have a very deep understanding of how the food supply affects nutrition and health outcomes.
Some of the ink that you saw in that video clip is actually created by food wastes. So they've collected carrot puree, for example, or pulp that's usually wasted, created it into a powder, and then reconstituted it to create these little lizards.
That would be one of the first questions, like what's in it? Yeah, you can make it look good, but what's in it?
What's in it? So the ink is actually quite fascinating, and there's a lot of opportunity to use 3D printed foods for, say, specific populations, like the aging population, where it's nutritionally created food products that look like a steak, not just slop on a plate.
Yeah.
You know what I mean?
Yeah.
We eat food, not nutrients. But food is our primary source of nutrition. It's the primary source of nutrients. I mean, unless you're sick, in hospital on an IV drip and given a medicated diet, that's different. But for everybody else, we eat food, not individual nutrients. Yes, there's a time and place for supplements, but overall, it is about total diet quality.
So if you're after an expert scientist who can educate and entertain on the role of food, your sector, on nutrition and health, well, please reach out, because nutrition is everybody's business.